According to the neurodevelopmental theory of psychotic disorders, which of the following statements best describes the proposed mechanism contributing to the development of psychotic symptoms? A. Psychotic symptoms arise primarily due to unresolved conflicts from early childhood experiences. B. Psychotic symptoms result from abnormal neurotransmitter levels in the brain, particularly dopamine dysregulation. C. Psychotic symptoms are caused by genetic mutations passed down through generati. B. Psychotic symptoms result from abnormal neurotransmitter levels in the brain, particularly dopamine dysregulation. The neurodevelopmental theory suggests that abnormalities in brain development, including neurotransmitter dysregulation, contribute to the emergence of psychotic symptoms. According to the diathesis stress model of psychotic disorders, which factor plays a crucial role in the onset of symptoms? A. Genetic predisposition, diathesis, combined with stressful life events. B. Socioeconomic status. C. Lack of social support. D. Neurological abnormalities. A. Genetic predisposition, diathesis, combined with stressful life events. The diathesis stress model suggests that genetic predisposition interacts with environmental stressors to increase the risk of developing psychotic disorders. Which theory suggests that psychotic symptoms represent a maladaptive response to stress and adversity? A. Diathesis stress model. B. Dopamine hypothesis. C. Neurodevelopmental theory. D. Cognitive model. A. Diathesis stress model. The diathesis stress model emphasizes the interaction between genetic vulnerability, diathesis, and environmental stressors in the development of psychosis. The developmental cascade model of psychosis proposes that A. Psychotic symptoms are irreversible once they develop. B. Psychotic symptoms emerge gradually, influenced by a cascade of risk and protective factors over time. C. Genetic factors are the sole determinants of psychotic symptoms. D. Environmental factors have minimal impact on the development of psychosis. B. Psychotic symptoms emerge gradually, influenced by a cascade of risk and protective factors over time. The developmental cascade model suggests that psychotic symptoms develop gradually, influenced by various risk and protective factors over time. B. Psychotic symptoms emerge gradually, influenced by a cascade of risk and protective factors over time. The developmental cascade model suggests that psychotic symptoms develop gradually, influenced by various risk and protective factors over time. B. The interplay of biological, psychological, and social factors in the development and maintenance of psychotic disorders. The integrative biopsychosocial model emphasizes the multifaceted nature of psychotic disorders, highlighting the role of biological, psychological, and social factors in their development and maintenance. John, who has been diagnosed with schizophrenia, is discussing his treatment goals with his psychiatrist. Which of the following treatment goals is most aligned with his psychiatrist's recommendation? A. Complete elimination of symptoms. B. Management of symptoms and improvement in functioning. C. Achieving perfection in daily routines. D. Enhancing creativity and artistic expression. B. Management of symptoms and improvement in functioning. Complete elimination of symptoms may not always be feasible, but managing symptoms effectively and enhancing functioning are realistic treatment goals for individuals with psychotic disorders. The research team is discussing potential directions for future studies in the field of psychotic disorder treatment. Which area of research is most likely to be considered promising? A. Ancient healing rituals. B. Astrology-based therapies. C. Ketamine-assisted psychotherapy. D. Bloodletting techniques. C. Ketamine-assisted psychotherapy. Ketamine-assisted psychotherapy is an emerging area of research in the treatment of psychotic disorders, showing promising results in reducing symptoms, particularly in treatment-resistant cases. David's family is concerned about his recent onset of psychotic symptoms. How might early intervention impact David's prognosis? A. It has no effect on prognosis. B. It worsens the prognosis. C. It improves long-term outcomes and reduces the risk of relapse. D. It increases the likelihood of developing other mental health conditions. C. It improves long-term outcomes and reduces the risk of relapse. Early intervention in psychotic disorders can lead to better long-term outcomes by reducing the duration of untreated psychosis and minimizing the risk of relapse, thereby improving overall prognosis and quality of life.